Hello, everyone. I'm honored to have the time with you today to discuss the work that Mymee is doing to help improve the lives of people with autoimmunity. So the focus of my talk is food, stress, and other triggers in autoimmunity. I'm Dr. Nicole Bundy. I'm a rheumatologist and Mymee's chief medical officer. And I'm going to spend about 15 minutes discussing the importance of diet and lifestyle in autoimmune disease. Following that, starting around 1:05 p.m., we have a real treat for you. One of Mymee's own health coaches will lead you in a 10-minute guided breath break for relaxation. So please go ahead and get something to eat, or maybe get up and do some gentle stretching, but listen in, because what I have to say today is important. I want you to learn what science is uncovering about the important role that our environments play in autoimmune disease and how you can use this information to help manage symptoms and improve your quality of life. Rheumatoid arthritis, Crohn's disease, Sjogren's, Hashimoto's, ankylosing spondylitis, and now COVID long haul, a new condition which appears to be driven by autoimmune reactions and already is estimated to affect millions worldwide. If you live with one of these autoimmune diseases, or maybe you have a loved one who does, or perhaps you're tuning in today because you treat patients with autoimmune disease, as I do, you know that despite the great advances in drug treatment, symptoms are not always adequately controlled. It's well known that people with autoimmune disease consistently score low on health-related quality of life measures, ability to carry out daily activities, maintain employment, fulfill social roles. These are all negatively affected and have been documented in studies like these and others. And I know that I don't need to tell many of you in the audience about studies to make you familiar with the symptoms and burden of having autoimmune disease. Fatigue, poorly controlled pain, cognitive trouble, digestive issues, these top the list of symptoms that drive down quality of life and often don't respond to traditional pharmaceutical treatments. And to make things even more difficult, your symptoms often vary day to day. How many times have you had a pretty good day or string of days only to wake up the next morning feeling lousy? You've taken your medicine as prescribed, so why are things so variable? Well, fortunately, we're starting to understand a growing appreciation of the profound influences that food and lifestyle have on the immune system sheds light on the complexity and variability of immune cell processes and opens the door for new ways to help patients. A groundbreaking study done at Stanford looked at twin pairs and saw that they had great difference in how their immune systems function. The researchers determined that close to 80% of this variability was determined not by genetics, but by non-genetic factors. Sleep, diet, chemical exposure, level of physical activity, and stress exert strong influences on how the immune system acts. And these influences, or triggers as they're becoming known, can determine whether a person gets an autoimmune disease or how severe an already established autoimmune disease becomes. Now, just indulge me for a moment as I show you just a brief glimpse at some of the research published recently in this area. Association of stress-related disorders with subsequent autoimmune disease. Infections, genetic and environmental factors in pathogenesis of autoimmune thyroid disease. Sleep disorders and increased risk of autoimmune disease. The impact of dietary components on regulatory T cells and disease. This is a growing list. Rheumatoid arthritis improvement after exposure to an anti-inflammatory diet. And SLE, or lupus, another autoimmune disorder influenced by microbes and diet. I think you're starting to see the point. But then you may understandably ask, if there's so much attention and interest in the role of diet and lifestyle in autoimmune disease, why hasn't so-called lifestyle medicine made its way into the standard of care for autoimmune diseases, like it has for cardiovascular disease or diabetes? Diabetes would never be treated exclusively these days with pills or shots. Dietary modification and exercise are integral parts of treatment. Likewise, as you know, with cardiovascular disease. Well, the reasons why comprehensive treatment of autoimmune disease, treatment that includes diet and lifestyle interventions, have not become mainstream for autoimmune disease, again, I believe are twofold. One, the immune system is amazingly complex, and this complexity makes it extremely difficult to tease apart and fully grasp the intricacies of its function. And two, immune system function varies widely by individual. This has important implications for studying how diet and lifestyle changes can impact disease. The same interventions, say the same dietary change, applied to one person will not have the same effect as it does in another person, even if those two people have the same diagnosis. So gluten-free may be very beneficial for one person with rheumatoid arthritis, but have little to no impact in another person with RA. And let's make things even more convoluted. The way someone eats and sleeps, moves and manages stress, these all interact and are interdependent. Take, for example, a woman with lupus who has an immune system that's reacting negatively to dairy, but she's also incredibly stressed out and sleep deprived. Sure, she needs dairy removed from her diet, but without attention to the stress and the sleep, she may not fully realize the benefit of that dietary change. And this kind of complexity and variability has affected study outcomes. Results of studies looking at the impact of lifestyle factors in autoimmune disease have been inconsistent. It's difficult to prove that one uniform intervention works in a population that's inherently different in their responsiveness to that change, even within the same diagnosis group. So yes, there are hundreds of compelling articles, but there's no one clear path ahead that fits everyone. Now, I know this information is not totally new to you. The internet is flooded with advice of wildly variable quality on diet, lifestyle, and other complementary approaches to managing autoimmunity. This can be confusing, overwhelming, and frustrating. Many patients understand that how they eat and how they live impact how they feel, but it's a guessing game. Some of you may have tried strict elimination diets, others the autoimmune diet or a Mediterranean diet. You may be taking supplements or trying acupuncture. And some of you thankfully have found symptom relief, but many are often left feeling no better, because the key to diet and lifestyle triggers in autoimmunity is that they're highly variable and individual. So how can you find your triggers amongst all this variability? It takes paying close attention and listening to your body and sorting through lots of data. At Mymee, we rely heavily on data to help us identify for each individual person the precise triggers we know play such an important role in autoimmunity. And this data that we pay attention to is data that our clients collect through a simple mobile app that lets them easily record what they're eating, as well as other daily habits that might be at play. We know it's impossible to remember what you had for breakfast, never mind what happened last week. So being able to track in real time on the phone is very handy. No paper journaling. By following this data over time, we start to see correlations between what might be triggering a flare in symptoms, what makes you feel really lousy one day, but you're okay the next day and you just don't know why. And whether that lousy feeling is experienced as fatigue, digestive issues, brain fog, or a host of other symptoms, our goal is to help you figure out what you might be doing or eating without even realizing it that's aggravating your immune system. And once possible triggers are identified, the next step is to make doable diet or behavior changes to address these triggers. And this is where our coaches come in. At Mymee, every client has a dedicated coach to help them solve their unique case by using the data that they share through the app. Mymee coaches are trained experts not only in health and wellness, but also in using data to understand how to guide very personalized behavior changes and to make those changes attainable and sustainable, all to deliver meaningful results. Mymee works across the wide spectrum of autoimmune diseases. We've helped people with over 60 different autoimmune diagnoses, and we've identified over 90 unique triggers, helping improve lots of different symptoms. Some of the triggers we've identified may surprise you. Sure, it's true that many people don't tolerate gluten or dairy, even nightshades. These are fairly common triggers and are linked to pain, fatigue, brain fog, and others. But so too are foods rarely thought of as potentially problematic. Each of the foods pictured here has been linked to symptom exacerbation in at least one person we've seen through our program. Some of these foods are actually more common triggers. And this is not to say these are unhealthy foods. On the contrary, for most people, I would encourage consumption of these foods. But in the wrong person, they can be triggering symptoms by contributing to immune activation. I'd like to briefly share with you outcomes from a randomized controlled trial showing how Mymee worked to improve quality of life in lupus patients. In the study, 50 adults with lupus were randomized to Mymee plus their usual care or usual care alone. Primary outcome measures were changes from baseline to 16 weeks in pain, fatigue, and scores on a tool designed specifically to assess quality of life in lupus. The results were impressive. 85% of participants saw improvement in fatigue, 40% saw improvements in pain, and 79% reported improvement in overall symptoms. In addition to this lupus trial, Mymee is amassing real-world evidence that validates our program. We're constantly expanding upon and drawing from the growing pool of data we have about different triggers and symptoms in autoimmunity to inform our understanding about potential correlations and then use it to guide personalized diet and lifestyle changes. So this is a look at our aggregate outcomes for Mymee clients in the last analysis period. There's a lot here. What I want you to focus on are the blue bars to the right. They indicate improvement seen in every domain measured. And there were statistically significant gains in 5 domains, including the ability to participate in social roles, ability to manage symptoms, fatigue, pain interference, and sleep disturbance. The improvements in fatigue are particularly notable as this is a ubiquitous symptom, frequently rated as severely debilitating, and often doesn't respond to pharmaceutical treatments. Now, importantly, what led to these improvements differed widely by individual. Autoimmune patients, when it comes to the most effective diet and lifestyle changes, are N's of 1. And this focus on personalized programs is turning people's lives around. Clinical data aside, there's no better validation for us than what we hear from our clients and from doctors we've worked with. Let me share a little bit of this. Eric, who has ankylosing spondylitis, said, "Mymee has been a central part of my life and a key route to getting to a better place for over a year now. The program has really been helpful, and I have uncovered things I never would have discovered on my own." Rita, a client with psoriatic arthritis and psoriasis, wrote, "I spent years avoiding gluten, assuming it was my only sensitivity. Every time I had a reaction, joint pain or inflammation, I thought I had a gluten contamination. Through Mymee, I discovered I also have a corn sensitivity. Every trip we took to Texas, I got sick. I assumed the chips or tortillas had wheat in them. Turns out I was missing the obvious, corn. Mymee helped me bring to light what I could not discover on my own." Jennifer, who has RA, said, "For the first time in 3 years since being diagnosed, I feel like I can finally imagine being healthy again." From Satvik, with Crohn's and psoriatic arthritis, "I used to wake up and only look forward to napping later on. Now I can't even nap if I wanted to because I have so much energy." And from a doctor we collaborate with, Dr. Herzer, "Mymee is a completely new treatment modality for autoimmune disease. And as a clinician, that's fascinating. It's a great alternative in a field that has not evolved very much despite pharmacological advancements." I want to share in a little more detail the case of Angela. Angela is a 34-year-old woman with undifferentiated connective tissue disease diagnosed back in 2014, and then undifferentiated spondyloarthropathy diagnosed just 4 years later. She also suffers from depression and anxiety. Even on Humira, methotrexate, and an antidepressant, she remained very symptomatic. She had daily joint pain, which she described as having to push through to get her daily activities completed, and I know a lot of you can relate to that. She also had a lot of digestive problems, frequent anxiety, unrestorative sleep, terrible fatigue, and trouble concentrating, all interfering with her quality of life. Angela came into the program already suspicious that she didn't react well to gluten and dairy, although she never fully eliminated them from her diet because she said it was too difficult. With the tracking, her coach saw patterns and was able to see that, yes, while gluten and dairy were triggers, other foods also triggered worsening of symptoms. Oranges, corn, potatoes, and nuts all made Angela flare. So, after successfully eliminating all of these foods, including gluten and dairy, from her diet with the coach's help, and starting to take some digestive enzymes and working on improving sleep hygiene, Angela got much better. Let's look at the difference this made in 4 months. Okay, here are Angela's scores on a tool called Promise, designed to assess health-related quality of life. In these 4 domains listed, ability to participate in social roles, cognitive function, managing symptoms, and physical function, a higher score is better. And a gain of 5 points or more is considered clinically meaningful and statistically significant. And I've indicated that with the red bar. So where Angela scored herself at the beginning of the program is in blue, and where she ended is in orange. And let's look at the scores. She experienced a 27-point improvement in her ability to participate in social roles. She made gains, as you can see, across the board, a 16-point increase in physical function. Now, here's a look at more of her scores. But in these domains, anxiety, depression, fatigue, pain interference, and sleep disturbance, a lower score is better. So again, where she started the program in blue, significant drop would be to the red bar, and where she ended up in orange. In all 5 of these domains, her improvements far exceeded the 5-point cutoff. Notice how much better her fatigue got, a 29-point improvement. But she also got better in sleep, depression and anxiety improved, and pain didn't interfere with her life as much anymore, all from identifying her triggers and following a personalized plan. This changed her life. In her words, After just a few months of the program, I'm now convinced I can fully manage, if not eliminate, my symptoms with recommended diet and lifestyle changes. Now, I've focused a lot on food triggers, and we do find that most people who come through us benefit from some degree of diet change, but I don't want to downplay the importance of other triggers, particularly stress. Managing stress is essential. We live in a world that feels like a pressure cooker. Not only that, being stressed out has become a kind of perverse proxy for success and achievement. It's a badge of honor, if you will. But existing chronically in a stressed out state has detrimental effects on the immune system that are clear. We need, as individuals and society, to learn how to promote relaxation to boost the rest and digest or parasympathetic activity. One of the best, simplest, and most accessible ways to do this is through mindful breathing. In fact, we at Mymee feel that even a few minutes of daily breathing exercise is so important that we host a free virtual breath break at noon every day. It couldn't be stated more clearly than it was in the title of this article. Stress as a trigger of autoimmune disease. Look what the authors write. Many retrospective studies found that a high proportion, up to 80% of patients, reported uncommon emotional stress before disease onset. They go on to argue that the treatment of autoimmune disease should thus include stress management and behavioral intervention to prevent stress-related immune imbalance. And with that, I'm very excited to introduce you to one of our coaches, Haley, who will talk with you a bit more about stress, breathing, and the immune system, and then lead you through a 10-minute guided breath break. Haley absolutely lives what she teaches. After being diagnosed with Hashimoto's as a teenager, she turned to yoga, nutrition, and lifestyle changes to manage her symptoms. She works closely with clients in our program for autoimmunity and COVID long haul. Haley is certified as a health coach by the Institute of Integrative Nutrition, and she's also a registered yoga instructor. Haley, take it away.
Thank you. It is so nice to be here. I hope everyone is having a great weekend. So we're here to talk about triggers, right? And Dr. Nick, you talked about how both food and lifestyle triggers can both impact our autoimmune symptoms. And at Mymee, I work with clients to discover both. So food triggers are typically really individual and really specific to each person. And lifestyle triggers tend to be a little bit more, impacting everybody, right? And so we're going to really focus on stress today, and how stress can really be a trigger for autoimmune symptoms in clients that I work with, in myself, in a lot of people. So the interesting thing is, whenever I start to talk about stress with clients, I hear a lot of times that most people don't really think it's an issue, which, I used to be like that as well. I think we tend to kind of dismiss that stress can really be driving why we're not feeling great or why we're having symptoms. And I think there's a couple of different reasons for that. I think a lot of us have become really used to stress. So we've been dealing with it for so long that it's just something that's part of our lives and not necessarily something that we really identify as an issue. Another reason I think some people don't think that stress is necessarily a trigger is because it's something that might be difficult to change, right? So we have a lot of these issues in our lives that aren't easy to change. And so we might think that there's no use in focusing on it if we can't really do anything about it. So even low-level chronic stress that you might not think is a big deal can absolutely impact your symptoms. And even though we might not be able to actually change the sources of our stress, we can change how we react to our stress, right? And so this is actually what I think is really, really cool. You have these situations where you can't necessarily completely change them, but focusing on what you can do can really make such a huge difference. I've seen it in myself and I've seen it in so many of my clients. So today I'm going to teach you what I do and what I teach other people to do to help deal with these stressful situations. So what we can do is we can activate our parasympathetic nervous system. So this is the nervous system that is responsible for rest and digest. To do this, we stimulate the vagus nerve. The vagus nerve runs from the back of your head all the way down to your abdomen. It connects your brain to your body. So once the vagus nerve is stimulated, your brain tells your body that everything's okay, it's okay to relax, everything's going to be fine. So there's a couple of different ways, actually there's a lot of different ways that we can actually activate this vagus nerve, and so therefore activate our parasympathetic nervous system. The opposite of the parasympathetic nervous system is the sympathetic nervous system. That's our flight or fight response, right? And so we don't want that. I think a lot of us are living in a chronic fight or flight response. So we don't want to continue to do that. We want to bring in the rest and digest response. So stimulating the vagus nerve, I like to kind of think about this in two categories, right? So we have physical and then we have psychological. So physical ways to stimulate the vagus nerve are singing. These are really fun. So singing, so, you know, maybe you're in your car, maybe you're in the shower, singing along to your favorite song, that actually can help to relax you. Gargling is another one, and just laughing. So those are three things that, you know, should be a joy, and they're kind of easy to fit into your day. All of these things that we'll talk about today are completely free. No need to spend money on them or anything like that. So those are the physical ones. And then the psychological ones are spending time in nature. So just going for a walk, maybe it is around the block, maybe it's to your favorite park, maybe, you know, if you live by the beach, it's down to the beach, but just surrounding yourself in nature and in sunshine, hopefully, can also help to allow your body to come into this rest and digest mode. Keeping a gratitude journal is another one that I think a lot of us don't really think of as can be actually helpful, but just writing down 3 things every day that you are grateful for can, again, train your body to get into this rest and digest or relaxed mode, and therefore calm down the inflammation that might be happening because of stress and calm down your symptoms. And the other psychological things that we can do are breathing exercises or meditation, which I will teach you. So I find that it's best to incorporate these things into your day, even when you're not necessarily feeling stressed. Okay, so this is the tricky part. All of these are free. All of them are really easy to do, but I find that most of us kind of go towards these exercises when we are feeling really stressed. And when they're especially helpful is when you do them every single day, no matter what. They can actually act as preventative and help your body, so you're not getting to that point where you're overwhelmed, you're not getting to that point where you actually are stressed and therefore having symptoms. So the more that you can just, you know, integrate these exercises into your day, again, they don't take long and they're free, the better that you will feel and the less affected by stress that you will be. So I'm going to teach you 2 of these today. They are my 2 favorite that I personally do very often. And I like to think of these as just being options that I have like in my wellness toolbox, right? So they're always available to me, as well as the other ones that I just mentioned. And the more often that I do them, I can go to them when I am feeling stressed, but I like to do them when I'm not too. So the first one we're going to do is actually one that I go to because it is a meditation, but I often hear people say that, you know, they're bad at meditating or they don't like meditating, they can't turn their mind off. Okay, so I'm going to walk you through a progressive relaxation meditation. It's kind of a mouthful. So I want you to find yourself in a comfortable seated position. Maybe that's where you are. Maybe you take a second to get up and go to the floor or go to the couch. You can sit cross-legged or whatever is most comfortable for you. And again, I'm just going to walk us through this progressive relaxation meditation. It'll be probably about 5 minutes long. So I want you to, again, get yourself in a comfortable seated position. And once you're there, just let your palms fall down to your thighs facing up. Roll your shoulders up towards your earlobes, let them fall back down your back. Option to keep your eyelids open, or you can just gently let them close. And we're going to start by focusing on your body. So this is a meditation, but I find it easy if you're one of the people that feels like your brain is always on and it's difficult to relax it. So I want you to scrunch up your toes, really, really tight, scrunch up your toes, curl them under on both feet, little bit tighter. And on your next exhale, just let them go, relax them. So we'll progressively move up our body doing the same thing. Moving up to your calves, I want you to squeeze your calves together, tighten them, clench them, tighter, tighter, tighter. And on your exhale, release, let it go. Feel how your calves just completely relax. Moving up to your thighs, we'll do the same thing. So tighten your thighs, clench your thighs. Tighter, as tight as you can. We'll hold this for a little bit longer. And on the exhale, release, let it go. Feel those thigh muscles just completely relax. Moving up to your core. So imagine that somebody's about to tickle you. That same contraction that you do the same thing here. So clench your stomach, clench your core, tighter, tighter, tighter. We'll hold it. And on the exhale, let it go. Release. Moving to your fingers. So curl your fingers into super tight fists. You can also start to clench your forearms here. We'll do our entire arm. So clench your forearms, your biceps, your triceps, your shoulders, clench everything together, tighter, lots of muscles here. Hold for one more breath and release, relax. Exhale, let it go. Moving up to the top, so you can clench your jaw, you can squeeze your cheeks together and your eyes. Nobody's watching you, so make a funny face. Squeeze, 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 squeeze. And on the exhale, release, let it go, relax. Let's take just 2 more huge breaths, kind of clearing out our entire bodies. So inhaling, starting at your toes, filling up your body. You can visualize this, filling up your body with new breath, expanding. Sometimes it helps to visualize like a light filling you up. Getting to all of those muscles that we just focused on, your toes, your calves, your thighs, your belly, each of your 10 fingers, your forearms, your shoulders, moving up to your neck and your jaw, the whole thing, filling yourself up with new breath, new possibility, new light. We're going to take a huge exhale together, sigh it out, let it go. If your eyes are closed, you can open them. Hopefully that was helpful for you. Again, that's one of my favorite meditations to do because it doesn't necessarily require you to sit still. It's focusing on your body, but at the same time, it is activating your rest and digest parasympathetic nervous system. So it's helping with stress. So moving on to another breathing exercise. This might be my all-time favorite. So it's called the 4-7-8 breathing exercise. So 4-7-8. I used to live in New York City. So if you ever saw me on the subway, I was probably doing this or any other stressful situation that I encountered. It definitely is my go-to. But again, I like to do it when I'm brushing my teeth or when I'm waiting for my hot water to brew in the morning. It's also a good one to do if you have insomnia. So you can do it when you're lying in bed. The more that you do it, the more used to it your body will get. And then something amazing happens. You find yourself just kind of doing it naturally, and it becomes less of something that you need to remember and something that you just kind of do. Okay, so hopefully you're still in the same relaxed position. We are going to inhale together as we count to 4. So inhale through your nose. So 1, 2, 3, 4. Hold that breath in your lungs as you count to 7, 6, 5, 4, 3, 2, 1. And we exhale through our mouth as we count to 1, 2, 3, 4, 5, 6, 7, 8. Don't worry if you can't hold your breath for 7 seconds. Don't worry if your exhale isn't exactly 8 seconds. We definitely don't want to stress about this. The main goal is you want to make your exhale about twice as long as your inhale. So let's try it one more time together. So inhale in through your nose as you count to 4. Hold that breath in your lungs as you count to 7. Exhale as slow as you can as you count to 8. Again, if your eyes were closed, you can let them open. I really hope that this progressive relaxation meditation and the 4-7-8 breathing were helpful for you. Again, do these as much as you possibly can, along with the other vagus nerve exercises that I mentioned: singing, gargling, laughing, spending time in nature. The more that you do these things, again, you will be able to relax your body and hopefully reduce your symptoms. Thank you so much for having me today. It was an absolute pleasure. Again, I hope everybody's having an amazing weekend. If you are interested in talking with a Mymee health coach, or if you'd like to find more out about the program, or if you'd like to join the raffle, check out our booth for more information. Again, my name is Haley, and have an amazing weekend.